Hi, I am Dr. Punitha Rangaraj, obstetrician and infertility specialist of Cambridge Hospital, also Bangalore. PCOD, otherwise it's called as polycystic ovarian disease. 5 to 10% of women in a reproductive age will be suffering from this problem. PCOD, basically the reason is a hormonal imbalance. The ovaries normally secrete a female hormone called estrogen and progesterone at certain ratio, and there is a small secretion of a male hormone called androgen. Whenever there is a disturbance in this hormonal ratio and there is a slight increase in the secretion of this androgen, multiple follicles are formed on the surface of the ovary. That is why it is called as polycystic ovary. The reason for this hormonal imbalance is not very clear, but there are a few triggering factors like stress, lifestyle, hormonal imbalance, and could be genetic. Suppose if your mother or a sister is suffering from a polycystic ovary, there are possibilities that you can also get this polycystic ovary. And what are the symptoms of this polycystic ovary? Basically, it causes irregular periods or no periods at all, sometimes prolonged periods, sometimes scanty periods. And it causes weight gain, causes acne, and the male distribution of hair on the face and the body, thinning of hair, and in case if you are married, that's because there is no ovulation when there is a PCOD, causes infertility. When it comes to the diagnosis basically made by the medical history, by the physical appearance, and also a few laboratory tests for these hormonal levels. And the last would be a pelvic ultrasound scan where you can see multiple follicles or you can see the polycystic ovaries. Coming to the treatment of PCOD, actually there is no treatment which is curative. It is basically given only to reduce the symptoms. As I told you, stress is one main cause for polycystic ovary. So try to reduce your stress by doing regular yoga, exercises, etc. Change your lifestyle. If you are a person who smokes or drinks, avoid smoking, avoid alcohol. A proper nutritional diet, a timely sleep are very important, and try to reduce some weight by doing regular exercises and following a dietary regime. And then your doctor will give a medical line of treatment. Medical line of treatment varies from person to person depending on the severity and depending on the requirement. Suppose if you are an unmarried girl with a PCOD, the doctor will concentrate on regularizing your periods and reducing your polycystic ovary syndrome like acne and hair distribution, etc., etc. But if you are a married woman, the more concentration will be given on infertility since you don't ovulate, which causes infertility. In a very severe cases, a laparoscopic ovarian drilling can be done.